My name is Anita Riccio-Spagnuolo, and I am the Coordinator in Fund Development at Canadian Mental Health Association. In 1991, I was diagnosed with synovial sarcoma at the age 11. Our prediction wasn't good. Our diagnosis wasn't good in the sense that they did say that it was terminal. They wanted to amputate my leg. Thankfully, my parents were wonderful advocates and great support from family. I was able to overcome everything. I did do 3 years of chemo and some radiation and some surgeries, but I'm here today and I'm very grateful for a second chance at life. My parents are Tino and Judy Riccio, born and raised in Amherstburg. My sisters, Sandra and Dina, and I went to St. Jean-Baptiste grade school. It was a French immersion school. And then we went to Villanova High School. I heard wonderful comments and feedback about St. Clair College, and the PSW course was a rewarding course, helping people. Didn't know if I wanted to go into nursing per se, so I wanted to start with that. And I found it to be a fantastic course that the college offered. My instructors were wonderful. Mary Powers was a wonderful, influential instructor for myself, and I just really enjoyed the PSW course. It's given me a lot in my life. I was able to work at Met Hospital through Malden Park, and it was for about 15 years on all different levels of care. So I started with the dementia, Alzheimer's floor, to psych, to long-term care, and it was a great experience. From there, I also was able to teach PSW courses at various of schools and colleges, and I was able to take out my students to placements at a lot of different nursing homes, so I was very fortunate. I also took my mental health and addictions and my RPN course as well, which was just something that I always wanted to do, and I'm happy that I was able to do it. I had formed a lot of empathy and compassion to my patients because I was there at one point. So I always instilled with myself as well as my students that treat these people like you'd want to be treated. And also just that you can be their only person that they see that day. So just to make it a good experience for them at each time that you walk into that patient or that resident's room. I was the fundraiser director for Harmony in Action. So Harmony in Action is a day program for people with disabilities. It is a wonderful organization that offers a great quality of life for their participants. We have our two main buildings, our Todo building and our main building right in Windsor. We have about 120 participants. I was able to fundraise for a $300,000 accessible playground, and it was built in 2017. One of my good friends, Jasmine JC, decided to get involved with Canadian Mental Health Association. She decided to get a group of wonderful, powerful women who were able to start a fundraiser called Rock Your Soul. Our first event was in 2017, and we were able to raise the most money in Canadian mental health history at one event. So it was $125,000, which was wonderful, and it was all spearheaded by Jasmine and our wonderful committee. In the last 3 years, just with Rock Your Soul, we are well over $300,000. At CMHA, we're very busy. We like to educate our community with a lot of our resources and programs that we do offer. We go into workplaces and schools to talk to kids and youth about the programs and services that we offer. I'm busy on the MOL grant, which is the Ministry of Labor grant, and we deal with all first responders dealing with PTSD, helping with peer support groups, their mental health and suicide calls. So we're very busy that way. And then, of course, we're planning several events throughout the year. I've been involved with Transition to Betterness for 15 years. I am on their action committee. So it's been 15 years, so we plan a lot of different events, and we support our events by attending and just promoting the event as much as we can. Doris Lapico and Tanya Sorge are just wonderful, strong women who had a vision and made it a reality, and they're definitely inspirational women to me. They've done a lot in our community with cancer patients and their families, and as mentioned, as a survivor, it's a tremendous impact. We didn't have those supports in 1991 that we do now, so it's wonderful to see that our healthcare is going forward. My husband is Gianfranco Spagnuolo. We've been married, it'll be 15 years this June, and then we were blessed with 2 children, Antonio, who is 10, and Natalia, who is 7. Both very active kids who are in a lot of different sports, such as soccer and hockey and baseball and karate and a lot of different other activities. So they definitely keep us on our toes. And then I'm also a counselor for the town of LaSalle. So that keeps me very busy as well. But for myself, I've always just liked to stay busy and keep focused on just trying to impact the community and do good in the community, and just to teach my kids to, always help and always offer your suggestions, your help, your leadership to someone, because you don't know what your smile can bring for that person that you're encountering. Just want to keep doing what I'm doing, and just advocate for mental health, for people with disabilities, for cancer patients, and just for the town of LaSalle. And I just want to be someone that my kids can look up to and say, she's a mom, and of course that's my number one.